Today I chose to talk about stress among healthcare providers. I chose this topic because I think people tend to overlook how much stress can affect a person. My initial thought was to focus on stress in the workplace among healthcare leaders. However, there is little research being done on this topic. So I chose to broaden my topic to healthcare stress among healthcare providers such as nurses. According to Barnes, studies show that people under intense stress can lose their motivation to work or learn new skills. One's ability to be creative may diminish, along with the confidence to risk new things. This affects not only the job performance, but the capacity to enjoy and participate in community life. Having work overload and low control induces a stressful work environment, creating burnout and resulting in low psychological and physical outcomes, as well as poor work performances in the workplace. Over the next 5 minutes, we will discuss factors that influence stress in the workplace, some research being done, healthcare manager stress, health outcomes of stress, and how to minimize stress. There are many factors that influence stress in the workplace. Lorna Bergman, Sandhull, and Schwartz discuss job demands and lack of control. Job demands is the workload, and this is perceived by the employee themselves. Lack of control is the freedom to make job-related decisions and the extent of skills used at work. Barnes discusses internal, external, and environmental forces. Some internal forces include lack of confidence, being over-involved in work, and being frustrated with difficult patients. Also, workplace conflict between coworkers is common because of this. Some external forces include understaffing and constant new policies and procedures. Environmental forces include the inability to provide quality work without lowering one's standards, working overtime, which is really common in this field since we are short of nurses worldwide, which involves most people having to pick up shifts and work overtime. And the last thing is being undervalued. Ilhan, Darukin, Tainer, Morale, and Buman also found that poor health, financial problems, and problems in one's own personal life can influence stress development. Next, we're going to discuss research. Research that has been done on this topic is different leadership profiles. According to Lorna Bergman, Sandhull, and Schwartz, there are vague leaders, super leaders, middle of the roaders, and gardeners. These leadership profiles are evaluated by measuring change, production, and employee. Change includes sharing thoughts and plans about the future. Production includes following rules and giving clear instructions. Employee is relying on subordinates and showing respect for others. The vague leader scored lowest in all three categories, while the super leader scored highest in all three. The negative about this article is that leadership profiles are not defined. We can assume what a vague and super leader are just by their names, but they are not defined in this article. The vague leader rated themselves lower than the rest on their decision authority, their ability to use their skills at work, they were more exhausted than the other leaders, and they had low satisfaction with quantity, quality, and work performance. Overall, they had low confidence in themselves. Next, being a healthcare manager involves balancing between opposing political and organizational demands, according to Lorna Bergman, Sandhull, and Schwartz. Chris, the nurse manager on my floor, agrees with this statement. She's had all the stressors of a registered nurse, but on top of that, she has the leadership stressors. She has all the tough decisions to make, but she has little to actually say on how she runs things because the hospital has policies that she has to follow. Lorna Bergman, Sandhull, and Schwartz found that there is little research on managers' own experience of their work stressors. Next, we will discuss health outcomes of stress in the workplace. Barnes states that there are physical and emotional outcomes. Physical signs include suppression of the immune system, which is causing these nurses to catch infections easier, high blood pressure, high heart rate, high respiratory rate, high insulin levels, and muscle tension. Some emotional signs include exhaustion, depression, anxiety, fatigue, lost enthusiasm to work, increased use of alcohol and drugs, trouble sleeping, and decreased interest to participate in social events. New nurses have high scores of burnout because they feel incompetent and question their own abilities. Last, we'll discuss ways to minimize stress. Ilhan, Darukin, Tainer, Morale, and Buman believe at-risk staff should be screened for burnout. However, I think all hospital staff should be screened maybe once a month through a questionnaire because every single staff and employee at a hospital, I think, is at risk. We can research this and follow up to see if there are any improvements. Supervisors should improve working conditions for employees by not understaffing as much as they can. We can try to use float nurses to decrease the workload or any other way, but we know we can't always do it, but just trying to minimize that will help improve working conditions. Next, health promotion is important. People must take care of themselves before they can take care of others. Next, when I asked Chris, my nurse manager, what she thinks about minimizing stress in the workplace, she said 3 things. 1, you have to keep your social life. 2, you want to keep your work at work and do not bring it home with you. 3, you need to find a way to reduce your stress, whether that's working out, reading, sleeping, eating. Everyone has their own way of doing this. But when they interview people, they interview them to see how they handle stress because it's so important. Reimer, Mates, Ryan, and Schletter found that reducing the exposure of noise and light at work can reduce individual work stressors. Hospitals already utilize this, and it's called quiet time. They do it 2 to 4 hours in the afternoon and then also at night. Better patient outcomes happen as well because it promotes relaxation. All right. In conclusion, everyone is going to experience stress at work. The most important thing is to find a way to reduce that stress. Healthcare workers experience high work stress due to job demands, lack of control, internal and external forces, and environmental factors. The physical and emotional outcomes from stressors are poor. Hospitals have already implemented quiet time. They should now implement burnout screenings for all employees, then decrease the external and environmental factors as much as possible to achieve the greatest employee outcome. And here are my references.